Thanks for stopping in and sharing some time with us. Today we're going to talk about the annual wellness visit, and we're going to talk about MACRA and MIPS. We're going to talk about how small independent practices can survive, handle all these regulatory challenges, and also make some extra money so their practice is more secure financially. Doing annual wellness visits is essential. When you do annual wellness visits, you can take care of all the metrics you need for MACRA and MIPS, and you can take awesome care of your patients in terms of preventive and screening care. You can do the annual wellness visit yourself if you want, but it'll take some time and effort to set the program up, to do the exams, and do the follow-up visits. An alternative is just to outsource your annual wellness visits to us. You give us the names of the patients you'd like us to see. We'll see them in their homes or in your office, and the annual wellness visit will be done. You'll have a great report. You'll see the patient in follow-up. Gaps in care will be identified. You'll provide immunizations. You'll provide further care. You'll refer for things like mammograms and colonoscopies. And then in the end, you'll have a few follow-up visits. You'll make money off the annual wellness visits. Your patients will have better outcomes because you'll be picking up cancers at an early stage, preventing the flu, and everything will be awesome. So again, you can set this program up yourself in your office, which will be great, or you can outsource it to us. But the key is just to get those exams done for the benefit of your patients. And once you do it for your patients and report the metrics, your reputation, your professional reputation will soar and improve dramatically. So there's going to be additional revenue as well, which is awesome. I mean, everybody can use a little extra money, especially if you have a private practice and you're small. This is the magnitude of the money that's available, and some of it comes from the margins on the annual wellness visits. You bill for the visits, you outsource it to us, you pay us, but there's a margin. You'll be doing follow-up visits on many of these patients, sometimes one visit, two visits. There's tests you're going to do. There's immunizations you're going to give. There's margin in that for you, and you'll be getting your MACRA and MIPS bonus rather than a penalty. So all in all, when you add it all up, there's $90,000 to $100,000 every year by participating with us in this annual wellness visit program. In addition, again, you'll be providing excellent quality care. And you'll be recording it and reporting it. Everyone will know that you're doing all the screening on your patients that need to be done. And you're going to find problems and cure problems. Take out a colon polyp, take out a breast lump at an early stage. And so your patients will have less problems with cancer because it'll be detected early. Also, in a study of 19,000 Medicare patients from a company that did annual wellness visits, they found that hospital admissions in those patients were reduced 40%, which is very significant. Emergency department visits were reduced 23%. Office visits actually increased by about 25%. So again, it's actual better care as well as recording that care, and in addition, getting better outcomes. Again, your professional reputation will soar because as you collect and report metrics, whether it's PQRS or MACRA-MIPS, whatever it is, when you complete and report metrics and your patients are doing and you're providing that kind of care, you look great to the insurance companies and you look great in those online surveys. MACRA and MIPS bonus money, again, it's important not to get that 9% penalty, but to get that 9% bonus. It's not going to be that hard to do if you're smart, because a lot of doctors are not even going to participate. We're going to help you with this and take care of 90% of the issues with MACRA and MIPS. And it's not just quality reporting, it's meaningful use type items with your medical record. It's performance improvement of the practice. It's also resource utilization. We'll take care of all that for you, and you'll be receiving maximal bonuses with minimal effort. And that all is included for free at no additional charge. Actually, we don't charge anything to the doctor and the patient. No copay, no deductible to the patient, no charge to the doctor. We do the annual wellness visit. You bill it, you pay us our fee, and then we do all these other things in addition just because we want to add value to what we're doing. And thank you for working with us and partnering with us. Finances, there's going to be a lot of money in it for everybody, especially the doctor. Here's just a little chart about $40,000 in additional revenue and follow-up visits, and this assumes a doctor has 2,000 patients. 20% of them are 65 and older. Half of those patients are in the traditional fee-for-service program. Some patients will require one follow-up visit, some will require two, and if you do the math, it comes to about $40,000 in additional revenue per year as follow-up from those annual wellness visits, and the follow-up visits will be when the patient gets immunizations, gets referred for colonoscopies and mammograms, and when all the good stuff happens. Total revenue per year per doctor is going to be about $95,000 plus or minus. Again, about $18,000 for the margin on the annual wellness visits, about $40,000 in follow-up visits, $19,000 in additional immunizations and tests that need to be done through your office, and about $18,000 over 6 years, talking about MACRA-MIPS when you're getting 9% bonus and not 9% penalty. Workflow, you give us the names, we set up the appointments, whether it's in your office or in their home. We make sure we have dedicated time in your office when it's convenient for you. We call the patient, or we get the information from them, populate the charts. The nurse practitioner goes out, finishes up the charts, confirms the information, does vital signs and then the exam, and then we prepare our annual wellness visit report, which goes to you and the patient, so you can have a follow-up visit which is highly efficient and effective, and where you and the patient are having meaningful discussions about what the next steps are. Why are we talking about it? Because there's a lot of challenges doing primary care now. You have to be efficient in how you work. You have to do all this screening and preventive care, which is great quality, and you have to comply with all the regulations. We have MACRA and MIPS now. We used to have meaningful use, and we had PQRS, and so it's challenging to practice efficiently, to use the electronic health records, to provide the kind of care you want, to meet those metrics, and also have a life and not work 100 hours a day, 7 days a week. Well, what do you get out of the program when you partner with us? You get more money. The metrics are collected and reported for you. Your patients are properly screened because you do that awesome screening. They get great service. They're happy because they're feeling good. You're keeping them healthy. They know you're catching stuff. It just seems to be understood. And again, your reputation in the online universe and with insurance companies as well as in the community is great. You get credit for what you're doing, you get recognized, you're working at maximal efficiency, and you get great outcomes. You can't beat that. Here's the annual wellness visit questionnaire. This is just the demographics, name, address, phone number. Here's a template we use to make sure we get a full inventory of patients' immunizations and screens, mammogram, pap smear, pelvic, pneumonia shot, flu shot, hepatitis shot, PSA, colonoscopy. Fall screening, one of our screens of how we screen for falls. Are you afraid of falling? Have you fallen in the past year? If yes, what are the circumstances? And then we also observe patients and how they stand, and do they have a good gait, and do they seem to be off balance? If they fail any of the fall screening, then they get evaluated by a physical therapist, and we find out, we report back so you can find out why they might fall, prevent that fall, which can result, as in a hip fracture or a hematoma, subdural hematoma. Here's the report you get. Kind of like this. It's going to look really nice. It's going to be well organized. Medications, problems, family history of surgeries, hospitalizations. It's going to go through immunizations, cancer screens. It's going to have a 5-year wellness plan and a summary of recommendations, as well as a summary of the inventory. And here's just an example of the screen where it has the name, address, phone number. It has all their medications. Here it has their medical problems and their allergies. Patients allergic to bee sting gets anaphylaxis. Here's when they got their last flu shot and pneumonia shot. Here's when they had their last colonoscopy, bone density, mammogram, PSA, prostate exam. On this screen it talks about we did the depression screening, the gait stability screening, alcohol screening, advanced directive screening. Here's in some detail about their functional ability, They have to shop with their daughter. They can't drive anymore, but they can bathe, get dressed, and they can get to the toilet. Here's an inventory of the patient's primary care physician, daughter, neighbor, caregiver, ophthalmologist. Here's a summary of recommendations. They need to be screened for depression, alcohol. They need a physical therapy evaluation because they're a little unstable. They're worried about their memory, so we'll do a dementia screening test. Here's all the recommendations that need to be done. Makes it real easy for the doctor. And here's some objections some guys have. Sometimes they say, I want to do it myself. I'm too busy to work with you, whatever. But bottom line is you need to get these done. If you want to do it yourself, great. If you want us to help you, we will. It takes a while to get this up and going. It can disrupt your office, but with us, it's completely outsourced. It's outside of your office. We have quality people. We're going to reflect really well on your practice. Your patients will get excellent care. You'll fill those gaps. You'll make more money. Your reputation will be great. Everything's going to be awesome. So if you have any questions, give us a call, email us, and we can answer any of your questions and get you started if you're interested. Thanks so much for listening today and being with us. Again, my email is jeff@casahc.com, casahealthcare.com, and send me an email, or you can call me at 203-598-8620. I'll talk to you soon.